Elevit Pronatal is a vitamin and mineral complex that is recommended to be taken during the second and third trimesters of pregnancy. Contains 12 essential vitamins, 4 minerals and 3 trace elements. Active ingredients. Vitamin A is involved in the synthesis of various substances, proteins, lipids, mucopolysaccharides. It ensures the normal function of the skin, mucous membranes, and organs of vision. Vitamin B1 normalizes the activity of the heart and contributes to the normal functioning of the nervous system. Vitamin B2 promotes tissue regeneration processes, including skin cells. Vitamin B6 helps maintain the structure and functioning of bones, teeth, gums, and has an effect on erythropoiesis. Vitamin B12 is involved in erythropoiesis, contributes to the normal functioning of the nervous system. B vitamins are involved in the formation of various enzymes that regulate different types of metabolism in the body. Vitamin C is involved in the oxidation of a number of biologically active substances, the regulation of metabolism in the connective tissue, carbohydrate metabolism, blood clotting, and tissue regeneration, stimulates the formation of steroid hormones, and normalizes capillary permeability. Vitamin D3 plays an important role in maintaining the balance of calcium and phosphorus in the body of pregnant women. Children with vitamin D deficiency develop rickets. Vitamin E is a natural antioxidant. Biotin takes part in metabolic processes, promotes the absorption of protein. Calcium pentophenate is involved in the metabolism of fats, proteins, and carbohydrates. Folic acid stimulates erythropoiesis, prevents the development of congenital malformations, neural tube defects in the fetus. Nicotinamide takes part in redox processes, provides the transfer of hydrogen and phosphate. Calcium is involved in the formation of bone tissue, blood clotting, transmission of nerve impulse, contraction of skeletal and smooth muscles. Magnesium is involved in the formation of muscle and bone tissue and also takes part in protein synthesis. Iron is a part of hemoglobin molecule, is involved in the transfer of oxygen in the body and prevents the development of anemia, including during pregnancy. Phosphorus, along with calcium, is involved in the formation of bones and teeth and is also involved in the processes of energy metabolism. Manganese contributes to the mineralization of bone tissue. Copper is essential for normal red blood cell function and iron metabolism. Zinc is necessary for the normal formation of the fetal skeleton and tissue regeneration. It is part of some hormones, including insulin. Indications. Elevit Pronatal is a unique vitamin and mineral complex that contributes to the proper development of the main organs of the child, the heart and brain. Elevit Pronatal is recommended to be taken during the second and third trimester of pregnancy. Elevit Pronatal helps expectant mothers to replenish the supply of trace elements necessary for the proper development of the child's main organs. Every day the body of the future baby is growing and developing rapidly, transforming from a formed embryo into a full-fledged human body. During this period, it is important to pay special attention to the development of the heart and brain, on which the functioning of the entire organism of the child depends in the future. Throughout pregnancy, women need to take into account the quality of nutrition in order to provide herself and her baby with all the necessary vitamins and minerals, the need for which increases to 150%. But getting these valuable nutrients from food is not always possible, as for the sake of the daily requirement of vitamins, it may be necessary to eat an exorbitant amount of food. Recommendations for use. The drug is recommended for use in the period of second and third trimesters of pregnancy in the recommended doses, 1 tablet per day during meals with a small amount of water. It is necessary to take into account the additional intake of vitamins A and D in order to avoid overdose. Before use, consult a doctor. Contraindications. Increased individual sensitivity to the components of the drug, vitamin A hypervitaminosis, vitamin D hypervitaminosis, hypercalcemia, hypercalcuria, severe form of renal failure, violations of iron metabolism, disorders of copper metabolism, Wilson disease, lactose intolerance, lactose deficiency or glucose-galactose malabsorption. The product contains lactose. Special instructions. The drug shall be taken in accordance with the recommended doses. When taking other vitamins or multivitamin mineral complexes, including nutritional supplements and or fortified foods, drinks containing vitamin D, vitamin A, synthetic isomers of isotretinoin and tretinoate or beta-carotene, a doctor's consultation is necessary, since increased doses of the latter can cause hypervitaminosis vitamin D and A. Side effects. Allergic reactions to the components of the drug are possible: urticaria, swelling of the face, skin flushing, rash, anaphylactic shock. If allergic reactions occur, stop taking the drug and consult a doctor. Gastrointestinal disorders, abdominal pain, constipation, diarrhea, nausea, vomiting, hypercalcuria, headache, dizziness, insomnia, irritability can be observed. Urine may be bright yellow in color. This effect is harmless is unexplained by the content of riboflavin in the preparation. The drug contains iron, which can lead to black coloring of the stool. This effect is harmless and has no clinical significance.